That's where my baby stays. Lord, there's a red house over yonder.
Welcome back to Live from the Heartland, program that happens every Saturday morning from the stage at the Heartland Cafe, from the heart, in the heart of Rogers Park, which is a bit on the gray side today, but maybe we'll see some sun come out. And it's a great day to work in your garden, do the laundry, move, all kind of, not laying in the sun type things. But we've got a great show today with some great guests who are going to educate us on a couple of different issues that we should know more about. We're going to hear in a bit from our friend Dave Kraft and an artist, a documentary filmmaker named Irene Zabytko, whose film on Chernobyl is gaining ground and interest. She had a couple events this week, and they're going to talk to us about the state of nuclear energy in our country right now and around the world. My name is Katy Hogan. I am your host today. My co-host Michael is celebrating his mother, Florence James' 96th birthday. I gotta say it. She's what a woman. What a woman. And so enjoy that celebration out there, James gang. So right now I'm gonna introduce and say hi to Susan Hurley
You got it.
and Sarah Howard.
Perfect.
Yay, Susan and
Good
Sarah.
Good morning.
We got the SH people here today. All right,
noticed
I'll
that as
stop
well.
being goofy.
Yes,
I
we're
don't
little
know.
doppelgangers.
I'm actually not sure if I'll stop being goofy today. It's kind of that kind of day. But we're talking about a serious issue.
We are.
Mm-hmm.
What you are going to teach us about, really truly, is the healthcare, health reform programs that are currently facing the Illinois legislature. And I'm going to ask you as many hints as you can give us about the state of the national healthcare reform. But Susan, you work with the Campaign for Better Healthcare,
I do.
and Sarah, you work with Illinois Maternal and Child Health Coalition.
Perfect.
Can you guys both describe your organizations for starters, and then we'll get into the nuts and bolts?
Sure. Illinois Maternal and Child Health Coalition is predominantly a policy and advocacy organization. So we focus on maternal and child health, which includes a lot of areas of policy in terms of all kids programs, Illinois insurance programs for moms and babies. We also work on school-based health centers, immunization for children, and we look at disparities in terms of birth rates, racial disparities in terms of birth rates in the city of Chicago. So we do a lot of policy and advocacy, but also community empowerment and education.
How long has the Illinois Maternal and Child Health Coalition been around, do you know?
We are turning 21 on Tuesday.
That's what I thought. What a great organization for all these years.
Definitely. We're coming of age.
There you go.
That's fantastic. And how about the Campaign for Better Healthcare?
Right. The Campaign for Better Healthcare is actually a statewide nonprofit dedicated to quality, affordable healthcare for all. We have over 300 coalition partners statewide, including Illinois Maternal and Child Health Coalition, and lots of other wonderful organizations. And the campaign has been around for 20 years this year. And we have a Chicago office and one in Champaign. I'm the lead organizer in the Chicago office, and mostly what we do is try and organize in different communities, whether it's the faith community or the small business community. We work a lot with other nonprofits, community groups, organizations that are committed to either healthcare advocacy or actually providing healthcare. We deal a lot with healthcare providers themselves too.
Really? So that there are, I'm curious about that last thing.
Yes.
Healthcare providers who are also interested in reforming the
Right.
healthcare system.
Well, let me give you an example. On Thursday evening, we had a town hall forum, a community summit on healthcare reform in LaGrange,
Okay.
where we've been organizing one of the western suburbs. And some of the co-sponsors of the event were AARP, Advocate Healthcare, which
Yes, sure.
clearly has hospitals all over the metropolitan area. the Illinois Nurses Association, the Community Nurse Health Association, again, a provider that's actually based in LaGrange, SCIU, and lots of other organizations were participating.
Yeah.
And that's just kind of an example of the variety of groups that we work with.
Over here in this neighborhood, about 2 years ago, a struggle resulted in getting a health clinic opened up through the Heartland, not related to this restaurant.
Heartland Alliance for Human Rights.
Exactly.
Another group, an organization that we work with.
Okay, very good. Are there organizations, are there health delivery folks who are kind of not joining in the coalition? Are there people who are not for reform, other than?
Well, there are people who would not. There are people who have a vested interest in the status quo, and that's always the case. And it's really, across the board, but most definitely, your major insurers and pharmaceutical companies, and some doctors, but doctors that themselves they're not a monolith.
Right.
And it's a
Very
very sophisticated community, and many of them, many doctors, feel this crisis, along with a lot of nurses. That's why INA was very interested in working on the summit in LaGrange, because their nurses are on the front lines of what we call the healthcare crisis,
Right.
and they know better than anyone why we need reform now.
Exactly. Did you want to add to that a little bit, Sarah, from your observation of part of the folks who work with you? Maybe you could mention some of the people who are
Sure.
a part
Our
of your
organization
bunch.
works a lot with direct service providers, including
Right.
social service agencies as well. And within those organizations, there tend to be a lot of very committed advocates for healthcare reform, because these are the people who are on the front lines and see the problems in the system every day, which is part of the reason why our organizations are so effective in our grassroots organizing.
Well, that plus we have a broken system.
We
have a
definitely
badly
do.
broken system.
Really badly broken. Last week on the show we had a gal who's part of the Chicago Women's Health Clinic, which is having a
Excellent group.
benefit
Wonderful.
here tomorrow, complete with belly dancing. And
That's terrific.
yeah, I used the Chicago Women's Health Clinic when I was your age and younger. I mean, that's how long it's been around, and what a tremendous service they've provided women. And then in the same show, we talked about hearing that U of C is closing down its
Yes.
women's clinic. So here we have we have the example of a community run and women initiated thing like the Women's Health Clinic, which has had, scraped along for many, many years, no professional, no big university or other kind of tie-up. And then we got the U of C hospitals, maybe the most wealthy kind of health-related organization in the country, one of them right up there. And they somehow can't keep their clinic open. There's something wrong with this picture, right?
Well,
go
what
ahead.
I
Give me
can-
insight about this.
Okay. I think I'm not really going to, comment on the financing specifically of the University of Chicago, but what I can tell you is that a lot of providers are really getting involved in the healthcare reform movement precisely because these 40 to 60 million uninsured people nationwide, 1.8 here in the state of Illinois, are showing up on their doorstep when they're finally critically ill.
Yeah.
And they're bankrupting themselves as a consumer, but
Right.
they're also bankrupting the hospital.
The system.
Because ultimately, we hear a lot about the bankruptcy statistic, right? That more than 50% of bankruptcies are due, at least
Are
in part,
caused
to
by-
medical debt,
yeah.
right? Well, the other thing to understand about that is 68% of those people had health insurance.
Right. But it wasn't adequate.
Right. But if the uninsured consumer shows up at the emergency room, they may go into debt, they may declare bankruptcy, but what that means is that the hospital isn't getting paid either.
That's right. Right.
And so that's kind of where the crisis just touches everyone, and why people are really feeling ready to act.